As a CHO, the healthcare providers, you have to supervise and at times directly get involved in collection of specimen for various tests and interrupt the results. While collecting any specimen for blood, you would have to take certain precautions to protect yourself and others from pathogens found in the blood. So let us look at what they are. Let us now discuss in checking of a blood sugar using glucometer. A blood sugar test is a procedure that measures the amount of sugar or glucose in the blood. The procedure involves pricking the finger and putting the blood on a glucose meter strip. Before taking blood sugar, review the patient's medical history for diabetes type, medications, anticoagulant therapy, etc. Determine if the test requires special timings, for example, before or after meals. Blood glucose monitoring is usually done prior to meals and the administration of anti-diabetic medications. First step, we need to gather following equipment and setup. 1. Disposal of latex-free gloves, glucometer, tissue or cotton ball, lancing device, lancets, glucose test strips, and ensure the meter has a working battery installed. In step 2, we have to wash hands thoroughly with soap and warm water for 20 to 30 seconds. Rinse and dry completely before continuing. Washing hands before this task will prevent infection. If the hands are not properly washed, there is a chance the glucometer could show falsely elevated results. In step 3, you are inserting the test strip into the glucometer. Take a single clean test strip out of the vial. Insert test strips into the allotted slot at the top of the glucometer. Make sure the strip is face up. The glucometer will automatically turn on and beep after the test strip is inserted correctly. When the meter is ready for a sample, a flashing symbol will appear on the screen. If the test strip is inserted into the meter incorrectly, the meter will not turn on. In step 4, you are preparing lancing device. Take a single unused lancet from supply. Remove cover of lancing device by twisting. Insert new lancet into a lancing device. Carefully remove protective cap from lancet to expose needle by twisting top slightly. Ensure not to poke yourself with tip of needle. Replace cover onto lancing device. In step 5, you are going to see how to adjust and load lancing device. The lancing device has several different depth settings which can be changed depending on individual skin. Adjusting the cover of lancing device will change the depth of penetration of the skin when device is triggered. The twist cover to 1 to 2 for delicate skin, 3 for normal skin, 4 to 5 for thick skin. In step 6, we'll see how to prick finger. Assess patient sites for skin puncture. Choose preferred area to sample. The most common site for sampling is fingertips. Pick up lancing device with the hand to prick. Firmly place loaded lancing device onto desired test site. Apply pressure and push green trigger button on the side of the lancing device to puncture skin. Set down lancing device after puncture. In step 7, sample blood is collected. Squeeze punctured finger slightly to allow enough blood to collect for sample. Pick up glucometer with the test strip inserted. Ensure meter is on and touch test strip to blood sample on punctured finger. Hold test strip to finger until enough blood is collected into the strip. The meter will count down and beep once it has received enough blood. If there was not enough blood received, the countdown will stop and the meter will read error. If this happens, the test must be repeated from the beginning with a new test strip, new lancet, and new puncture. Set down meter and apply pressure to punctured finger with tissue or cotton ball to stop bleeding. Step 8 will read the test results. After receiving the blood sample, the meter will automatically display the blood glucose results on the screen. The test results range from 20 to 600 milligram deciliter. The range for normal blood sugar levels is 60 to 100 milligram. The results will saved automatically on the meter and they can be viewed later if necessary. To view previous test results, turn on device and press yes on the meter. Step 9. Proper disposal of equipment. Remove use test strip from the meter with the tissue. Throw away in the appropriate disposal. container. Be careful when removing the lancet from the lancing device to ensure there are no accidental pricks or injuries. The lancet will be ejected from the lancing device. Dispose lancet in appropriate container. In step 10, recording the result, it is helpful for write down glucose levels in the personal logbook of the patient to monitor blood sugars and record the blood sugar levels in the register maintained by the community health officer in the health and wellness center.
Welcome to the HemoQ HB301 system instructions on how to collect a capillary sample and perform a measurement. In order to obtain reliable and accurate results, correct capillary sampling collection technique is key. To perform a test, the cuvette holder should be in its loading position. The display will show 3 flashing dashes and the HemoQ symbol. Make sure the patient's hand is warm and relaxed. Use the middle or ring finger for sampling. Avoid fingers with rings on. Clean the fingertip with disinfectant and let it dry. Stimulate the blood flow by applying a light pressure from the top of the knuckle towards the fingertip. Keep a light pressure to puncture the side of the fingertip using a lancet. Wipe away the first 2 to 3 drops. Then, press lightly until a